How do rural stroke patients access brain imaging? Rural stroke patients often face significant hurdles when it comes to accessing brain imaging, which is crucial for diagnosing strokes accurately and swiftly. Understanding these challenges can help us appreciate the complexities of stroke care in rural areas. First, many rural hospitals lack advanced imaging equipment. For instance, only a small percentage of these facilities have computed tomography scanners, and even fewer are equipped with magnetic resonance imaging machines. This scarcity means that immediate brain imaging, which is vital for timely stroke diagnosis, is often unavailable in rural settings. Geographic barriers also play a significant role. Patients living in rural areas may need to travel long distances, sometimes hundreds of kilometers, to reach hospitals that offer the necessary imaging technology. This travel can delay critical imaging and treatment, pushing patients beyond the crucial time windows for effective therapies like thrombolysis, which dissolves blood clots, or endovascular thrombectomy, a procedure to remove clots. Moreover, studies indicate that rural stroke patients utilize advanced imaging techniques, such as computed tomography angiography and computed tomography perfusion, at much lower rates than their urban counterparts. This disparity is often due to limited resources, fewer trained personnel, and underfunding in rural healthcare facilities. These factors restrict the use of advanced imaging that guides stroke interventions. When rural patients requiring more specialized imaging, they often need to be transferred to larger urban hospitals or comprehensive stroke centers. While this transfer is essential for accessing advanced care, it can introduce delays that are detrimental to patient outcomes. To address these challenges, many rural hospitals are now participating in telestroke programs. These initiatives allow remote neurologists to evaluate patients and their imaging results in real time. This setup facilitates quicker decision-making and appropriate triage, increasing the likelihood of administering intravenous thrombolysis, even when local imaging resources are limited. Access to brain imaging and stroke care is also influenced by regional and socioeconomic factors. Rural areas with lower income levels and fewer hospital resources tend to have less access to advanced imaging and stroke treatments. This contributes to the higher stroke mortality rates observed in rural populations compared to urban ones. In summary, rural stroke patients primarily access brain imaging through local hospitals with limited capabilities, by being transferred to specialized centers, and increasingly through telemedicine support. However, geographic distance, resource limitations, and systemic disparities continue to pose barriers to timely and equitable access. Improving imaging infrastructure, enhancing telehealth services, and streamlining transfer protocols are essential steps toward better stroke care in rural communities. Always consult healthcare professionals for personalized medical advice and support.